Welcome to another case study. So this is a case study. Start the image below and answer the subsequent questions. So as you can see, this equipment. So question A is saying, what is the name of the equipment? Then B, give four. It's saying give four indications for use. Then C saying, describe how you insert the above equipment. Okay, so describe how you insert the above equipment. Okay, so what is the name of this equipment? So this equipment, as you can see, this is an NG tube, which is a nasogastric tube. So an NG tube, or you can just say NGT, but in an exam setup, just say nasogastric tube, then in brackets that's when you can say NGT. Then indications for this condition. So indications, we can have give a nasogastric tube in feeding when you want to for feeding purposes. So other people will even classify them, but otherwise you can just give out the indications. But if it's in an oral exam or a practical exam where there is actually, we can even try to classify the indications, but for this case study sake, we are just going to mention them. So you can give it in a feeding, you can give it for feeding purposes when there is an absence of swallow reflex in an unconscious patient. You can also give it to decompress the GI. So for example, when someone has a paralytic ileus, then you can use it in gastric lavage, in analysis of stomach content, if there is physical injury to oral cavity, inflammation or CA esophagus. You can also give it in premature babies to prevent aspiration. So those are some of the indications you can for you to actually give an NG tube. Then we are on C. So describe how you insert the above equipment. So describe how you see. So how you insert. So patient has to sit upright in the sniffing position with the neck slightly flexed. And if the patient is unable to sit upright, then they should lie in the left lateral decubitus position. Then if needed, supine and bed elevated. So the patient can even lie in supine and the bed should be elevated. Then you are supposed to put on gowns, gloves, and a face shield or face mask if you want. Then you check the patency for each. Check for patterns of each nostril by holding one closed and asking the patient to breathe through the other nostrils. So that's checking the patterns. Then look inside the nostril for any obvious obstruction. Then you eliminate then you estimate the depth of insertion. So you get the NG tube itself, you straighten it, and you estimate the proper depth of the insertion. Then about the distance to the ear lobe or angle of the mandible, then to the xiphoid process plus 6 inches. Then you have to note which black mark on the tube corresponds to this distance. Like on the NG tube, there are some black marks. So let me just mark them on the screen. So these are some of the black marks that there you can see there are 3 black marks there. So we start from the nose from the nose to the ear lobe, then you go to the angle of mandible, then you go to the xiphoid process. You can check if it's at this marking, or these are there. We have 2 markings here, so those are 2 markings. So these are the markings on the NGT. But if maybe where it has corresponded, it's maybe here, then you can just try to just touch there, so that when you are inserting, you are not going to go above that point if maybe there are no marks there. Then after you have successfully marked where you are going to end when inserting, then you have to lubricate the end of the nasogastric tube, meaning you lubricate this part, and this is the same part which is supposed to be near the nostril. That's the part which is supposed to be near the it's the first part which is going to go in the nostril. So it's the one which was supposed to lubricate first. So lubricate the end of the nasogastric tube, then gently insert the tip of the tube into the nose and side along the floor of the nasal cavity. Then aim back, then down to stay below the nasal tubinet. Then ask the patient to swallow or take sips of water through a straw or advance the tube during the swallow. So you can be telling the patient to be swallowing as if they are swallowing it. So tell the patient to be swallowing as you are advancing the NGT. Then continue to advance the tube during the swallows to the predetermined depth using the black marks on the tube as guidance. Then you assess for proper tube placement. So there are questions on how they can even ask you like, how do you assess for proper tube placement? So after you're done, you are supposed to assess for proper tube placement. But this question just said describe how you insert the above equipment. So we have described how we inserted the above equipment. So if they asked maybe how to assess for proper tube placement, so there are a lot of ways. You can check for the pH, you can use a stethoscope, you can also use water in a galley pot to check if there are any bubbles. You can also try to aspirate. There are a lot of ways to check for proper tube placement. So we will make another case study on on that part, how to check for proper tube placement of the NG tube. Okay, thank you for watching, and please subscribe if you haven't subscribed, and hit the bell notification, and check out other case studies.